Every muscle in my body was hurting.
Her weight just kept falling, falling, and falling.
We handed him off to the doctor. It just broke me in half.
I thought, oh my gosh, not Sharon, not Sharon.
What we wanted was a diagnosis.
It was scary.
Next, 3 medical mysteries that defied the experts. Roman Magana is a beautiful little boy with one extraordinary problem, a strange head tilt that his parents fear could ruin his life.
Kids would point at Roman and say, what's wrong with his head? Why doesn't he pick his head up?
Then, 16-year-old Sharon Callahan is a champion diver with a bright future, until terrifying symptoms send her spiraling into depression.
I had come to the realization that my life was over.
And 42-year-old Peggy Hickman is in the prime of her life when her body begins literally wasting away with no end in sight.
I was tired. I was thin. I looked like a skeleton.
When illness strikes, we look to doctors to give us answers. But what if they can't? For these unlucky patients, diagnosis is a mystery. On September 19, 2000, Connie and Gabriel Magana welcomed their second child into the world, a baby boy named Roman.
I was extremely excited. We wanted to have another child.
I've always wanted a son. I wanted to grow up and look just like me and play ball and just, do everything that I did with my dad.
But when Roman is just a week old, the Maganas notice something is wrong.
I noticed he wasn't picking up his head. Whether I was giving him a bath or he was eating, sitting in his swing, laying on the bed, if I was holding him, his little head just kind of seemed to plop down to the side.
Concerned, Connie takes Roman to the pediatrician.
And the doctor said, this is not a big deal, don't worry about it. He's just a newborn. Some children's muscles take longer to develop, strong enough for him to hold his head up. He says, we'll check him when he comes back in a couple of months. So I said, fine.
I was relieved. I felt like, okay, I'm satisfied. It'll just heal on its own.
But 6 months later, it isn't any better.
Gabe thought I was just making something out of nothing, but I knew there was something more. When we went in, I asked the doctor, look, can you please take a look at this? I'm extremely concerned. He is not able to lift his head. He went ahead and felt around Roman's neck, his back. He wanted us to go see a neurologist. And he said, if the neurologist can't find anything or if he finds something, our next step would probably be to send you to an orthopedic surgeon.
I was like, no way. No one's gonna cut my son open. I don't want any part of surgery. I was thinking, everything's gonna be fine. He's gonna pick that neck up and he's gonna just start using it right one day.
Otherwise, Roman is perfectly healthy, and he's hitting all of his developmental milestones. The Maganas decide to hold off on the neurological exam and see what happens as he gets a little older. Then, when Roman is 7 months old, they notice something else.
One day I was bouncing him on my lap, and I had a toy that I was playing with him. And when he turned to look at me, his right eye was looking at me, but I noticed that his left eye was way over in the corner. And I said, Connie, there's something wrong with his eye.
When he would lift his head up, we noticed his eye would roll back. And I was concerned about that. I thought, oh, that's not good.
I thought that maybe, his eye was just a little off center. However, he could see, he knows who we are. He knows how to grab things, he knows how to open things.
Gabe doesn't think it's serious enough to warrant another trip to the doctor. But as the months go by, Roman, who always had good motor skills, begins to get clumsy.
Once he started to walk, he would misjudge turning corners in the house, and he'd bump into walls, just trip, fumble over, his feet.
It seemed like I couldn't leave him alone for a minute. One time, he went to try to get a ball. The ball was probably about a foot away from the stove, and he didn't realize it, so he went to try to reach for the ball, and he reached for the stove instead. and he got a really good burn right above his eye.
I would think he was just, being a klutz.
I, however, was a bit more concerned. I just didn't think that was normal with him constantly bumping into walls.
Nonetheless, Connie decides to wait and see if Roman grows out of it. But as Roman gets older and the Maganyas take him out to play more often, they realize that what they think is no big deal is very noticeable to others.
People commented on it and noticed him right away when we would bring him around friends, around family, around the church, anywhere we went.
Kids would point at Roman, and adults would look at it and say, "What's wrong with his head? Why doesn't he pick his head up?"
Someone called him a taco neck because of the diagonal type of motion that he would make on his neck. I didn't like that at all.
Roman is now 14 months old, and the Maganyas take him back to his pediatrician, demanding answers. After an examination, the doctor still can't find anything wrong with Roman's neck. But for the first time, he notices the problem with his left eye. He suspects Roman has Duane syndrome, a congenital eye disorder characterized by an impaired ability to move the eye from side to side.
He described it as double vision. He had no depth perception. And that kind of explained the reason why Roman was constantly bumping into the walls and the furniture and into the doors, because he didn't see things the way we saw things.
Connie wants another opinion. She sees two ophthalmologists who confirm the Duane syndrome diagnosis. They also make it clear that there is no treatment for this condition.
He said, I've seen cases like Roman. He has this condition. No one's ever died from it. They just adjust to life this way. And I didn't want to accept that. I thought, I can't see my son at the age of 15 walking around like this.
Since he was born, 1.5-year-old Roman Maganya has been suffering bizarre symptoms. A mysterious head tilt and a wandering eye, and no doctor seems to be able to help.
There's just a cloud of fear in our household as far as not knowing, what's going on.
But just when the Maganyas think the doctors have all but given up on Roman, an ophthalmologist they had seen previously calls with a new lead. A professor at UCLA who specializes in pediatric eye problems.
He said he's one of the best of the best. He said if any guy can help you, this would be the guy to help you. And at that point, I just said yes, immediately. How soon can I get there?
In June of 2002, almost 2 years since Roman's strange symptoms first came to light, the Maganyas bring him to Dr. Sharon Eisenberg.
Mrs. Magan had explained that Roman had received a number of diagnoses from different doctors, which were conflicting.
And I told him, we've been told he has Duane syndrome. And Dr. Eisenberg said, no, he doesn't.
Dr. Eisenberg explains that children with Duane syndrome don't tilt their heads. Instead, they turn them to the left or right. He then runs a series of tests on Roman's eyes to see if he can figure out the real problem.
He had little finger puppets, and he would ask Roman to follow them with his eyes.
We'd see how the eyes track the toys. If one eye is preferred, he'll look with one eye and let the other eye go upward or downward.
After a few more tests, Dr. Eisenberg is pretty certain that Roman's left eye is misaligned, but has to rule out one last possibility, the possibility that the problem is related to Roman's neck muscles. To determine this, he simply covers Roman's left eye with a patch.
If the head tilt is due to the eyes, with the patch on, the child's head will straighten it. Whereas if it's due to a tight neck muscle, the head will continue to tilt even if the eye is patched.
What happens next leaves Connie stunned.
I couldn't believe it. Roman's head was straight up. I thought, wow, this is it. This is it.
That told us that this had to be due to an eye problem and not due to a problem in his neck.
He explained to me, Roman compensates by tilting his head to the right. That's how he can focus. That's how he can see straight. And that just explained everything.
The findings all led to one diagnosis, and that diagnosis is what we call a fourth nerve palsy.
Fourth cranial nerve palsy is a congenital disorder that causes the eyes to become misaligned. There are nerves in each eye that control eye movement. The job of the fourth nerve is to move the eye downward and rotate it. If the muscle tendon which is attached to the fourth nerve is too long, it can't control the eye properly. The eye then drifts upward, causing double vision. Children will often compensate for the misaligned eyes by tilting their heads in order to bring the eyes back to the same level.
Roman's problem actually lies in the fact that one muscle, and only one muscle, is underacting. It's amazing when you think that if we're off by just a half a degree, we have double vision.
And Dr. Eisenberg has more good news for Connie. Roman's eye problem can be fixed.
There are surgical procedures that can actually address the exact anomaly that he has in his eye muscle, reverse it, and restore normal eye movements.
I was extremely relieved.
Connie immediately calls Gabe to give him the diagnosis and tell him about the surgery.
But when I gave him the exciting news, Gabe just didn't react the way I wanted him to react.
My heart sunk. I got just a sick feeling in my stomach. I wasn't really ready to trust anybody to put him to sleep and operate on his eye.
He said no. He said, Roman's too young. I don't want to have it done.
Desperate, Connie turns to Gabe's Aunt Isabel to see if she can convince her nephew to agree to the operation.
The best argument that I could come up with was just so that he could have a normal life. Do you want people making jokes about him? Do you want him running into walls the rest of his life?
I realized that I had to stop living in denial. I just had to think about how my son was going to grow up. If we don't take this chance, we'll never know.
A few months later, on Halloween 2002, 2-year-old Roman is brought in for surgery.
They prepped him. They gave him a little gown. They gave him a mild liquid sedation.
Dr. Eisenberg has done hundreds of these procedures and assures the Maganyas that Roman will be fine. Still, there are risks putting anybody, especially a child, under anesthesia.
I don't know how the procedure is going to go. My biggest fear is just him not coming out.
One of the doctors assisting said, okay, Mom, I'll take him. Oh, my heart just broke. My heart just, it broke. And Roman said, bye, Mommy. Oh, it just broke me in half. But I knew it was for the best. I knew he'd come out better.
Surgery for fourth nerve palsy is difficult. Up till now, Dr. Eisenberg has only been estimating what precisely is wrong with the tendon connecting to the muscle inside Roman's eye. It could be too long, misaligned, or missing altogether. He won't know which until he actually opens Roman's eye and looks inside. What Dr. Eisenberg discovers is that the tendon is too long. In order to increase tension, he must fold the tendon and sew it onto itself to make it shorter. It's an extremely delicate procedure.
The trick is to decide precisely how many millimeters to tuck. You could do too much or you could do too little. I was able to raise it between 5 and 10 millimeters easily off the eye. That shortens the tendon and allows the eye to function normally.
If Dr. Eisenberg is off by even a millimeter, Roman will have to come in for more surgeries until he gets it right. After just 1 hour, the surgery is over, and Roman is wheeled into recovery.
When Roman woke up, I wanted to hold him tight. I didn't want to let him go.
I was really happy he had woken up and everything looked fine, everything looked normal.
The very same day, Roman leaves the hospital, but the real test is yet to begin. Did the operation fix Roman's eye problem and head tilt? The next day, the Maganyas remove Roman's bandage.
We stopped to eat, and I picked up Roman, and I was holding on to him. Isabel was sitting right across me. She goes, oh my goodness. She goes, look at Roman. She goes, look at his head. And I said, what's wrong with his head? And she goes, it's not tilting anymore. It's not tilted.
His eye looked normal. I remember saying, geez, I can't believe it. I just can't believe it.
It was a happy ending to a long and very, very scary journey.
But for many families, there is no happy ending. Fourth nerve palsy can often go undiagnosed and untreated for years.
The pediatrician thought it might be a neck anomaly because that's perhaps what he saw more commonly in his practice. With this possible diagnosis, you must stay with the patient. You must examine all their eye movements, whether it's left, right, up, down, head tilt, not head tilt. Put the whole picture together and see if you come up with the right diagnosis.
Today, 5-year-old Roman is just like all the other kids. He enjoys playing video games and baseball with his dad.
Today, Roman is doing beautifully. His eyes are straight in every gaze position, his head is straight, and he has absolutely no restrictions whatsoever. He is cured of it.
Well, it's been 3 years since the surgery, and Roman is a normal, rambunctious little boy.
I look at Roman and I see miracles. I'm amazed by him because there is no greater joy than knowing your son is perfectly healthy and there are no obstacles in his life that are restricting him from anything he wants to do.
At just 1.5 years old, Roman Magana was unable to communicate to anyone what he was seeing or feeling. Not so for Sharon Callahan, a brilliant high school student and varsity diver. When she started experiencing bizarre symptoms, she was too terrified to tell anybody. It all began one snowy day in January 1981.
My mother was driving me and my little brother to diving.
Sharon was in the front seat with me as the passenger. My son Michael was in the back seat. I remember mentioning what a beautiful day it was.
We had just pulled onto the highway. A car coming from the opposite direction flipped over the median strip and landed on the hood of our car. At the impact of the accident, I was thrown forward. My head had gone into the dashboard, and it was about 15 minutes, I would say, that I was unconscious.
EMTs arrive and pull Sharon, Michael, and their mother out of the car. All three are rushed to the hospital. The doctor examines Sharon's eyes for a concussion and takes an X-ray of her shoulder.
I was asking him, about my head. So he checked my eyes. I don't have a concussion. I should be fine. He gave me a sling, and I would say within about less than 2 hours, we were discharged.
Sharon has a sore neck for a few weeks, but otherwise appears fine. But then, a few months later, while the Callahan family is out to dinner, Sharon begins acting strangely.
So 6 of us around the table. I noticed Sharon picking up a glass and drinking her water and then asking her brother, "Are you going to drink that? Can I have that glass?" And that's when I look around and see that Sharon drank everybody's water.
My mother looked at me with these big eyes saying, "What is going on?" I said, "I don't know. I'm just really, really thirsty."
The waitress was looking at her like, "Didn't I just pour her glasses of water at this table?"
On the drive back home, Sharon still can't get enough to drink.
We had to stop at every bathroom along the route for Sharon.
It's more than just your mouth is parched. It's almost an ache in your entire body that is feeling like it needs hydration.
Then, for the next few days, things get worse, as Sharon begins getting up at night to drink.
I was getting up at least every hour, where I was finding myself having to drink, 3 or 4 glasses of water every time I would wake up.
Concerned, Sharon's mother takes her to see the family doctor.
And I thought, oh, Sharon must have diabetes. One of the symptoms of diabetes is excessive thirst.
The doctor agrees and tests Sharon for sugar diabetes, also known as diabetes mellitus. It's a condition in which the body doesn't produce enough insulin to break down sugar, resulting in dangerously high blood sugar or hyperglycemia. The buildup of blood sugar overwhelms the kidneys, and they increase production of extremely dilute urine, resulting in excessive thirst and urination.
Diabetes runs in our family. Both of my father's parents died of it, so it was a very high likelihood that that's probably what I had.
But when the diabetes test comes up negative, the doctor has no explanation for why Sharon is drinking so much water.
I was realizing that I would just be stuck with excessive thirst forever.
For the past year, 17-year-old Sharon Callahan has been battling a relentless, unquenchable thirst. She's consuming 3 gallons of water a day, but never feels satisfied. No doctor can tell her what's going on, so Sharon decides she's just going to have to live with it. In the summer of 1982, she graduates third in her class and gets accepted at an elite university on a diving scholarship.
I was going to be entering college with a pre-med major and competing as a freshman on the varsity team for diving.
Within days of starting her freshman year, Sharon's new friends label her the girl with the blue cup.
When I see Sharon in my head, I see Sharon with her cup walking around, always drinking.
I was probably drinking about 15 to 20 of water jugs that were about this big. It was approximately 3 gallons of water that I was drinking in any given day.
She drank almost constantly, and I did think it was very odd.
Sharon is still making frequent trips to the bathroom day and night, and living in a dorm makes it more difficult.
You have to get dressed, walk all the way down the hall. It turned into a 10 or 15-minute trip every time you had to get up to use the ladies' room. I never got more than a 45-minute straight period of sleep.
Sharon is thirsty, exhausted, and having difficulty concentrating. The pre-med major is getting harder and harder to keep up with. What's more, reading all the medical information in her textbooks has begun to really scare her.
Some of the symptoms that I was having could kind of point to a brain tumor, or that I was a schizophrenic and had completely lost my mind. Both of them to me were just absolutely terrifying.
Sharon is so scared that she has a brain tumor that she decides not to tell her family what's been going on.
I didn't really get into any of the symptoms. They were kind of all kept in the dark. I think that they were under the impression that the excessive thirst was under control.
Then, while at home during spring break of her junior year, Sharon is sharing a room with her sister when something terrifying happens.
Sharon would wake up in the middle of the night, sit straight up in bed, eyes wild, and just scream at the top of her lungs. She would shake, she would sweat. The episodes would last anywhere from a couple of seconds to a couple of minutes. It was scary.
Vicky notices that if she gives Sharon water, it has a soothing effect.
If she drank water, she was able to relax enough, pull herself back together, realize where she is, and then be comfortable enough to go back to sleep.
The sisters just think that Sharon is having nightmares and never tell their mother about the episodes. A week later, back at college, Sharon has another terrifying experience. While driving back from a concert with friends, she runs out of water to drink.
About halfway home, things started getting very, very scary. I felt my heart racing. I was very, very dizzy. Every muscle in my body was hurting and twitching. It almost felt like there was thousands of little pins being stuck into my skin.
Her friend begs to take her to the emergency room.
I absolutely did not want to go to the hospital. I thought if they took me to the hospital, they would find a brain tumor.
When Sharon finally arrives back at her dorm, she immediately downs a gallon of water.
Drinking the water was the only thing that would take the pain away.
But this time, it's too close a call.
The morning I woke up after the concert, I had come to the realization that my life was over. I felt like I didn't have any chance left. I almost didn't want to live anymore. I couldn't keep living the way I was feeling. It was very, very painful. It was frustrating. I was depressed. At that point, after hiding a lot of the symptoms for so long, I called my mother. I said, Mom, I have some really serious things I need to talk with you about.
I started shaking. I was just so overwhelmed with what was going on with her.
With just 2 weeks of classes remaining, they decide to seek help as soon as Sharon returns home.
I finished my last 2 exams, and I actually left college knowing I was never going back. It was the end. I said goodbye to all my friends. I didn't tell them that what was going on, but I knew it was the end at that time.
For 4 years, 20-year-old Sharon Callahan has been hiding her strange symptoms from her family, terrified that they might point to a terminal illness. But a close call one day shocks her out of her complacency. She tells her mother about her unquenchable thirst, her inability to concentrate, and the terrifying seizure she had in the car. Her mother takes her to see Dr. Howard Miller, a specialist in internal medicine.
We started at the very beginning with Dr. Miller.
Sharon started telling me she was a diver. She went to school. The studies weren't doing very well. She couldn't concentrate.
Dr. Miller went through all of my symptoms: excessive thirst, excessive urination.
She mentioned to me that every time she goes into a car to take a long auto trip, that she would take a glass of water with her. And it seemed to be relatively large quantity. And then she said she was urinating a lot.
Dr. Miller thinks he has an idea where Sharon's symptoms are coming from, but he needs more data to prove it. First, he orders a CAT scan of Sharon's brain.
Dr. Miller had ordered a CAT scan to rule out the possibility of a brain tumor. Of course, panic, it's a possibility. That means, oh, that's gotta mean I've got one.
I was sick. Oh my gosh, not Sharon. Not Sharon.
2 weeks later, to everyone's relief, the CAT scan comes back normal. No brain tumor.
I was both relieved and not relieved. And I was thinking, well, if it's not the brain tumor, then it's the schizophrenia.
The absence of a brain tumor gives Dr. Miller one piece of the puzzle. The next step is to admit Sharon to the hospital for a 24-hour water deprivation test.
You measure the urine and the blood, and you measure the weight of the patient.
I was scared to death. I could not possibly imagine not being able to drink for a 24-hour period.
Within an hour of starting the test, Sharon begins to feel strange.
I started feeling the little pinpricks on my skin, feeling dizzy, and I still continued to have to go to the bathroom every 30, 40 minutes.
4 hours later, Sharon is dehydrated and in critical condition. She hasn't had any water, but is still producing massive amounts of urine. Her vital signs are bad, and her blood pressure is crashing.
Sharon lost 5 pounds of weight in 4 hours. That's very frightening, and that's the point in time when we had to stop the test.
Dr. Miller has narrowed down the possibilities. Something is preventing Sharon's kidneys from absorbing water to keep her hydrated. There's one likely suspect, a hormone called vasopressin.
The hormone goes to your kidney and causes you to start reabsorbing water so you don't urinate as much.
Dr. Miller immediately gives Sharon an injection of the missing hormone.
Within minutes, I started feeling better. Within an hour, I didn't need to drink massive amounts of water. I no longer had to go to the bathroom. It was really unbelievable.
Lo and behold, her urine concentrated and went back to normal. We finally had an answer we were looking for, and she had what's known as central diabetes insipidus.
Diabetes insipidus is a rare hormonal disorder that leaves the body unable to absorb water. Normally, the hydration levels in the body are regulated by the pituitary gland at the base of the brain. If the body is dehydrated, the pituitary sends a hormone called vasopressin to the kidneys, telling them to reabsorb water instead of turning it into urine. But if the pituitary gland is damaged and cannot send the signal to the kidneys, the body never knows to hold on to water.
People with this condition can urinate 22 quarts of urine per day. If you start losing that, you start losing your essence. You run the risk of getting low blood pressure, going to shock, and dying. Sharon kept herself out of harm's way by drinking water. If she had at any point in time been in a situation where she did not have access to water, Sharon could have died.
For 4 years, Sharon kept her condition a secret. But to the doctors she did tell, the symptoms were misleading.
Some of Sharon's symptoms were due to sleep deprivation, and that's not a typical textbook piece of information. As long as you're drinking and you do not get dehydrated, you may not know.
But there's still one piece of the puzzle missing. In many cases, diabetes insipidus is caused by a tumor in the brain or the pituitary. But Sharon's CAT scan is clear. Dr. Miller asks Sharon one final question.
I said, "Did you ever hit your head?"
I thought that was a very odd question. I said, no.
And then I said, well, wait a minute, Sharon. How about 4 years ago?
And then that all came back to me.
4 years before I met her, she had been hit on the head, had significant head trauma, and this had affected her pituitary. There's a little channel between the base of your brain and your pituitary that gets damaged. Suddenly your brain cannot make the hormone, therefore your body is lacking that hormone, which causes you to hold back water.
I was shocked. I've never heard of anything at all like this, and I never even knew that was possible.
Dr. Miller tells Sharon that the treatment for diabetes insipidus is simple. All she has to do is inhale the synthetic version of the hormone vasopressin twice a day for the rest of her life, and she will be fine. The following fall, Sharon goes back to school to complete her senior year of college. She finally feels like her old self again.
Tremendous difference in Sharon. Totally different person. She was almost like she was a child again.
I went back happier than I've probably ever been in my life.
Today, 25 years later, Sharon, a mother of 2 girls, has boundless energy.
Sharon always wanted to have a family. She talked about having kids, even as far as back as when we were in college.
Sharon has everything, and everything she ever wanted, Sharon has now.
I really understand how precious life is. I saw the possibility of me not having that life anymore, and it's almost like I was given a second chance.
Sharon Callahan spent 4 years hiding her symptoms. But when Peggy Hickman's body started changing, the active 42-year-old mom did everything she could to make herself heard, but no one was listening. It all started during a morning run, when Peggy began feeling short of breath.
It was almost like when you just take a small breath in, and it would hurt. Like breathing on a really smoggy day, or after running really hard in the cold. When I came home, I went directly to my room and just lay on my bed.
She was complaining of tiredness, the fatigue, and she just lacked the normal zest that she had.
And I knew that something was wrong. I just knew in my heart something was wrong.
"42-year-old Peggy Hickman, who is used to being in great shape, is suffering from shortness of breath and terrible fatigue. She assumes she's just been overdoing it. Then, one day, while refereeing a soccer game, Peggy senses something really is wrong.
As I was running and I would come to a stop, it was just a sharp pain in my knee. And then it gradually moved into both knees.
The next day, while typing at work, Peggy feels the same sharp pains in her thumbs.
It was excruciating. The pains would just shoot to the tip of my thumb and sometimes to my elbow. I explained it to myself as possibly being arthritis or just being on the keyboard too much during the day.
Peggy makes an appointment with her doctor. After an examination, she is diagnosed with a mild form of carpal tunnel syndrome, a common source of hand pain caused by increased pressure on a nerve in the wrist. It can be brought on by trauma or injury, or by repetitive motion, such as typing. The doctor prescribes braces for her hands and an anti-inflammatory drug for her knee pain.
She had been my primary care doctor for 6 or 7 years. So I just went along and said, okay.
But a month after her appointment, Peggy feels no better. She stops wearing the braces and her hands continue to hurt. Then, a few weeks later, while on a trip with her sisters, they notice a strange new symptom. Peggy's ankles and calves are swelling uncontrollably.
They reminded me of pregnant women where their ankles swell to like 3 to 4 times the size that they normally are.
By the time she returns home a few days later, Peggy's hands and fingers have swollen up too. Unable to use her hands, Peggy's family has to help her do simple everyday things.
She started having trouble tying shoes, just putting on her clothes, buttoning things.
Concerned, Peggy returns to her primary care physician.
She was trying to find out all these reasons why I would be swelling, and she decided then she would order blood tests.
1 week later, she receives the results.
She kept saying they're negative. I mean, you were tested for lupus, you were tested for everything under the sun. Viral, HIV, you name it. She was actually stumped.
Peggy's primary care physician has no idea what's causing her symptoms. So she refers her to a specialist in rheumatology, Dr. Janice Leshak.
Her complaints and problems were fatigue, aching and stiffness, and swelling and pain, primarily in her feet and ankles. My initial impression was that she might be an early presentation of rheumatoid arthritis.
Rheumatoid arthritis is an autoimmune disease that causes chronic inflammation of the joints. If the disease progresses, it can lead to destruction of bones, joints, and ligaments. Dr. Leshak orders x-rays of Peggy's hands, feet, and knees. A week later, the results are in.
The results were normal. The bones were normal. The alignment was normal. There were no erosions. There were no signs of rheumatoid arthritis on the x-ray.
So I wasn't extremely happy because it still didn't tell me why I was swollen and why it hurt to walk.
Over the next few weeks, Peggy returns to her primary care physician and countless specialists. But still, no one can explain what's happening to her body.
One doctor suggested I was depressed. Another doctor just thought that it was a flu. One doctor thought that I had a bowel problem. I, at that point, was almost in tears.
What we wanted from the doctors was a diagnosis. We didn't want to hear depression. Depression isn't causing the legs to swell, the knee joints. Tell us what it is.
Peggy and Peyton are now terrified that whatever she's suffering from could be slowly killing her.
As Peggy continued to decline, we were getting pretty desperate. You know, if we don't get some help soon, we felt like, you know, maybe it was over.
My husband and I finally talked and, you know, started to say, well, we have to prepare for the worst. And, you know, we talked about the girls. It worried me to think, what's going to happen if something happens to me and I'm not there? You know, what if they need me? What if they need to talk to me and I'm not there? What ultimately kept me going was that I wasn't ready to give up. I wasn't leaving my daughters. Not yet.
For the past 9 months, Peggy Hickman's once athletic body has been slowly wasting away, and no doctor can figure out why. Since her symptoms appear to be related to arthritis, Peggy decides to go back to the rheumatologist she had seen 6 months earlier, Dr. Janice Leshak.
When she returned, the swelling of her ankles and her feet and of her hands were still there. She also was having some changes in her fingers with cold exposure, that they seemed to becoming pale or a bluish discoloration, which sounded like Raynaud's phenomenon.
Raynaud's phenomenon is a vascular disorder that affects the blood vessels in the extremities. Upon exposure to cold or emotional stress, fingers and toes lose circulation and turn white, blue, or red.
Raynaud's phenomenon, that's often an initial or an early presentation of a serious condition, and that's when that crossed my mind as that this might be something more.
Dr. Leshak has a hunch that Peggy is suffering from an autoimmune disease. Her body is attacking itself.
For some reason, there's a switch, and the immune system, the immune cells that are often in the bone marrow or in the lymph glands, are producing antibodies against some of the body's own native tissue or native organs.
To make sure, Dr. Leshak orders scores of blood tests.
As the tests went on, I felt I was becoming a human guinea pig, but it was a relief because I felt, okay, now we're headed somewhere.
1 week later, 9 months after Peggy's first symptom appeared, the blood tests come back. Dr. Leshak's hunch was right. Peggy does have a rare autoimmune disease.
The blood tests, in conjunction with her symptoms of the swelling of her fingers, the thickened skin of her fingers, the Raynaud's type symptoms that she was having, seemed to fit the diagnosis of scleroderma.
Scleroderma, which means hard skin, is an autoimmune condition affecting connective tissue throughout the entire body. It occurs when the immune system, which normally protects the body from germs, goes into overdrive and attacks healthy tissue. This produces inflammation and an overproduction of the protein collagen. The excess collagen deposits in the skin, causing it to harden, and in the joints, causing pain and swelling. If collagen accumulates in internal organs, such as the esophagus, lungs, intestines, and heart, it can lead to death. It's no surprise to Dr. Leshak that Peggy has gone undiagnosed by so many doctors. Scleroderma is often a very difficult disease to pin down.
It is like a detective story. It's almost like a puzzle in a way, and sometimes the pieces fit on the first visit and sometimes they don't. And in Peggy's case, they really didn't.
To have a name attached to the condition and finally realizing you're not a hypochondriac, it was a moment of happiness.
And it just felt like the whole world was lifted off our shoulders.
But the happiness doesn't last long. Dr. Leshak has some bad news about the diagnosis.
Scleroderma, it's one of the more frustrating autoimmune diseases. There certainly has been a lot of advances in the treatment of scleroderma. But at this point, there is no cure and there is no real disease-modifying drug or medication that really can make a difference.
But having a definitive diagnosis gives Peggy a new resolve.
I thought, no, I've got to find something.
Peggy independently sought out a study at UCLA, which has a world-renowned scleroderma specialist, Dr. Philip Clements.
Well, at UCLA, we've had an interest in scleroderma for 30-plus years. Peggy Hickman emailed us, and we emailed back, and then we got together.
After a thorough examination, Dr. Clements immediately enrolls Peggy in a year-long study to test a new drug that might slow down the progress of the disease. Peggy must take the drug every day for a year and come in every few weeks to get tested.
A couple of weeks into the program, I noticed that the breathing in, it didn't hurt. It was actually really exciting.
It's now been a year since the clinical study ended, and the drug hasn't been approved yet. Peggy is on a different medicine to control her symptoms and is still being closely monitored.
I feel really good. I mean, I do have my bad days, of course, but overall picture, I feel really good.
But Peggy knows she isn't out of the woods yet. It can take up to 5 years for scleroderma to fully evolve. Since she's in her 3rd year, Peggy doesn't know how many more symptoms she will experience.
There's still going to be some changes. Over the past year, my hands have contracted where they have now, I can no longer straighten them out.
In Peggy's case, the long-term prognosis is still a little open to question. The more time that goes on, if your lung function remains pretty good, your heart function, your kidney function, you're in a pretty good place.
There is no healing in scleroderma, but with all the researches that are going on, who knows, they may find a cure.
Peggy is just loves life and enjoys each and every day.
I try to think I haven't changed at all. I think I'm still the same person on the inside, just a little different on the outside, that's all.